Hello, students, and welcome to my narrated PowerPoint on intervention with individuals. This will cover overview of strengths-based intervention, as well as roles of social workers and approaches for working with individuals. First, start out with some key ideas to the strengths perspective. These should be familiar to you from last semester and our units on values of the social work profession, as well as Schulman's interactive model of helping. Certainly there is a lot of overlap conceptually and in terms of assumptions. The strengths perspective offers a focused, committed effort for identifying, expanding, and sustaining the resilience and assets that client systems bring to their interface with the world. The strengths-based approach views supporting the client as central to the worker's action. Here's a list of different intervention skills of the strengths perspective. I'm not going to elaborate on each of these, but just to point out a couple. The third one down, the focus on client. This seems to be something that comes natural to us as social workers and fairly intuitive. But to give an example of where it may be a challenge and something important to remember, when working with younger clients, children, teenagers, for example, who may be brought into our practice by their families, it's important to listen to the client's perspective rather than to be focused on the parent's perspective or a particular system that the client is in conflict with, such as a school. The very last one listed here, supporting clients' environments, just to elaborate a little bit more on what that means. Environments, or what I'll often refer to as systems, are important to recognize and understand that our work goes beyond the office or the one-to-one interaction with the client, but also critically looking at the systems in which the client lives, navigates, however you want to put it, and in some cases stepping into those systems to create greater responsiveness to your particular client. So some principles here, just continuing on. Social worker acts in context. What this means is that we first must work collaboratively with the client to identify what that context is, and a synonym here might be a particular problem. What brought the client in there? And that is going to create the scope of your work with the client. Social worker works with the client system to move toward normalizing and capitalizing on one's strengths. So again, the system can go beyond the individual. It may involve working with families. We invite work with families, significant others in a client's life, or unique systems such as a school setting, a neighborhood, a residential setting, etc. Here are some central ideas or underlying assumptions of the strengths perspective. They're important to keep in mind. Many people are able to function relatively well in spite of the difficulties they face and the resources they can't or don't access. People are resilient and possess skills, ideas, and determination that need to be considered when developing interventions. Change happens when social workers collaborate with clients' aspirations, perceptions, and strengths. And just to make a point here, the strengths perspective is a foundation for our work with clients, whether we are applying a particular treatment modality, such as cognitive behavioral treatment that we're going to briefly look at later, or working with them in the context of family therapy, or primarily as an educator or in case manager. Some more points about the focus of strengths-based intervention. Clients are experts in their situations and the solutions to problems. Intervention should begin where clients are, sometimes referred to being where clients are at. One example of this is that many of our clients, again, are brought into our practice because they are in conflict with larger systems around them. One convenient example might be the mandated client who is going to see you because of a DWI. She or he may not perceive there being any problem other than the legal issues that she or he faced. So understanding that perspective is very important rather than being a step ahead of the client. And so here are 4 areas to look at for strengths-based assessment of clients: environmental resources and strengths, environmental deficits or obstacles, personal resources and strengths, personal deficits or obstacles. In the following slides, we'll have examples of each of these, which I'm simply going to allow you to read on your own. So now we look at 4 different roles of social worker, some of which you are already doing in your field placement, but just as a general review. Social workers are educators at different points in our work with individuals. We possess knowledge about specific problems, whether it have to do with mental health or health issues, and it's important for us to share that information with clients to improve their health and wellness. Case management is a whole area of social work and can best be described as coordination of resources for a client. Case managers may work very briefly with clients, as in the case of discharge planning, or it may be a very long-term relationship, as in the example of working with chronically mentally ill patients who are living in the community and trying to maximize their independence of living. Case manager collaborates with a variety of service providers, assists a client in navigating systems, whether it be informing them of how to enroll in different entitlements, different programs that will help them. In some cases, assisting them in getting to appointments, making appointments. So just some of the examples of what case managers do. In some cases, there's very specialized types of case management, behavioral case management as one example, where a case manager will also be involved in the evaluation of a client's progress and keep very close documentation. Social workers are advocates, naturally, of course, and we advocate in a variety of different ways. Advocacy takes us into other systems. So this may be, for example, advocating for a client within his or her family so that a child is better understood, that parents are better able to respond to unique needs. It may be advocacy to a larger system. Again, a common example, a school system. So a client that you're working with is experiencing bullying. The advocacy would be in educating teachers about this problem, trying to mobilize some level of response so that there's greater safety for this particular client. It may be bringing in programs to educate the school community about bullying and specifically to educate the student body about bullying in order to change behavior. When we talk about social workers as mediators, this isn't mediation between two clients. We mediate between the client and the systems with which she or he is mutually dependent, as we discussed last semester. So we mediate with the family system in many cases, for example, helping the client to function better in that context, in an employment context, in the larger community. And we may do this through advocacy actions. We may do this from contacting other service providers. Again, the idea of mobilizing resources, making an environment more responsive to the client's needs. So we're going to briefly look at two commonly used approaches in social work, and this is going to be, a very brief type of overview. Cognitive behavioral treatment, we will have a guest speaker on this topic toward the end of the semester to go in more detail. Solution-focused brief therapy, you've had some readings on this topic as well, but I'm going to go over some of the basic tenets of the approach. And hopefully we'll have some time to talk about this in class because these are probably the more complex parts of the presentation today, or tonight, whenever you're watching this. So cognitive behavioral treatment, it falls under cognitive therapies. So I have included a definition from the Encyclopedia of Social Work. Cognitive therapies include sets of strategies focused on education, a restructuring of thought processes, improved coping skills, and increased problem-solving skills for clients. The focus is more on thoughts versus feelings, for example, and at least on the connection between thoughts, what thoughts create what types of feelings for the client. Some of the reasons that cognitive therapies are used so widely, they can be applied to many different types of clients at all different developmental stages, functioning levels, and to a wide range of problems. And some of the most common areas where you'll find cognitive behavioral therapy would be addictions, depression, and anxiety. They have been shown to be effective. They're evidence-based. They've been studied and shown to create positive behavior change. They provide clients with new coping strategies. and they're flexible in that they can be combined with other approaches. So cognitive behavioral treatment is actually a combination of the cognitive, the thought processes, and the behavior acting on those thoughts. And that then introduces the use of positive reinforcement for behavioral change, which may be as simple as praising the client for progress that she or he has made, or it may be more structured structured types of rewards. For example, in a residential setting, a client receives additional privileges for their good behavior. Then turning to solution-focused therapy, the treatment is directed toward developing and achieving the client's vision of solutions. And there are some techniques to achieve this. Looking for previous solutions. What did the client do previously to try to overcome the problem they're experiencing today? Looking for exceptions. When and how did that work or not work, for example? Solution-focused therapy is present and future-focused. And this is something that is sometimes something to adjust to for us social workers who are trained in doing thorough biopsychosocial assessments, trained in psychology that understands that early childhood experiences, family experiences are very important for understanding how a client functions in their adulthood and their various coping mechanisms and negative behaviors that may have emerged from that. Solution-focused therapy doesn't, for one thing, doesn't really have time for a in-depth exploration of a client's past and their family relationships. And it also believes that that's not as important as looking at how the client is going to overcome their present problem. So intentionally, there's a very brief review of the client's past, and you move into the present, and later, as we'll see, into what the future might look like for the client if they had their way. Practitioners employ compliments as a form of positive reinforcement. They invite clients to do more of what is working. So again, using the client's perspective, joining with the client's perspective on what has been successful, and validating that this is a good strategy. And last, we have the very interesting miracle question that's employed. And I'll try to describe this with some degree of clarity in this presentation today, though this is a concept that we may need to talk about a little bit more in class, because it's something that you sometimes want to see in action in order to understand. But the miracle question basically would go something like this. Toward maybe the midpoint of this introductory session that you're having with a client, where you have, defined what problem the client brings in his or her terms, you would ask the client, I'd like you to think about when you leave the office and you go home and tonight you go to sleep. And imagine that overnight a miracle occurs. How would you know that a miracle occurred when you woke up the next morning? How would you feel differently than you feel now? What would be different in your environment? And there's a variety of other types of follow-up questions that go along with this. But the basic gist is that you want to tap into the client's imagination of what their life would look like if they were unburdened of the problem that they're facing today. And to describe that in a variety of different ways, not simply in a cognitive way about, how they would be thinking differently or how the world would treat them, but also in how it would feel and thinking about significant relationships that might be different. So advantages of solution-focused brief therapy. Well, certainly on a practical level, um, this is used because we don't always have the luxury of working with clients over the long haul. This may be because we work with clients who are very ambivalent about participating in treatment, so you may only see them 2 or 3 times. This solution-focused therapy provides a good opportunity to engage them quickly and briefly in an effective type of treatment. It also may be the realities of health insurance, the number of sessions that are covered, or in a particular setting, such as a school setting, where you only see students a few times during the school year, or again, it may be hard to engage them. Sort of related to that, this is especially used in mandated settings where client resistance is an obstacle. So clients mandated for addictions treatment, the solution-focused approach, rather than working on education, trying to build awareness that the client has a problem, helping the client to articulate what problem they see in their life and focusing on what it would feel like to overcome that particular problem. I think solution-focused therapy is very helpful because it reaches clients on an emotional level, which helps sustain change. You may have gotten the sense from my description of the miracle question that this gets clients really feeling like they've overcome the problem by talking about, what it would be like to wake up and whether a magic wand was wafted overnight or something happened miraculously beyond their control. This is something that evokes an emotional response and produces a great deal of relief for the client. I have included in here a short video on this type of therapy that I would like you to watch, and it also includes some excerpts of interventions with clients.